Well, thanks for coming back here for our second media briefing of the day. I apologize that I had to call you back. We have some information that we didn't have available at 10:30 that we wanted to talk through, and that is regards to some testing that we've seen in testing results in Minnehaha and Lincoln County. So our current status to date has always been operating at the lowest level of the CDC mitigation strategy. All right, there's the none. Then there's the minimal to moderate level of spread, and then there's substantial community spread. To date, Sioux Falls, Minnehaha County, and Lincoln County both have been in the none category. Based on testing that has come in, we now have enough data to confirm that Minnehaha County has moved to a level of substantial community spread, which means 5 or more cases. So I just want to be very clear on that. When you say substantial, that means 5 or more cases. That doesn't mean 500. That means 5 or more. Lincoln County has moved from none to minimal or moderate level of spread, which is due to 1 confirmed case of community spread. So this is a time we all knew was coming, and we're ready for this. We're not going to have a press conference every day to announce new numbers or new increases. The reason this is substantial is it moved us to a different tier of our response strategy. In anticipation of us knowing that this was likely the direction we were moving, we introduced just a half hour ago an agenda and an ordinance that we're asking our Board of Health to consider. That is online now for you to view. That is available at siouxfalls.org. It's a long URL, /mayor/boards-commissions/board-health/board-health. It's long. But if you simply go to our boards and commissions page, you'll see the Board of Health, and you can see that agenda, and you can see that ordinance that we're going to be introducing. People have, since this morning, have had a lot of questions on that. What does that mean? It's all spelled out for you. Again, to be very clear on what we are recommending is any business that falls within the governor's executive order is going to be limited to 10 or fewer patrons, not people, patrons, on their business premises. That means patio, that means inside, outside, 10 people on their premises. Essentially, it's a very strict ordinance. It will be enforceable by a Class 2 misdemeanor, which could also include the ability to pursue suspension of licenses. So in the case of a bar, it could be the suspension or revocation of a liquor license, for instance. So severe. There's teeth to it, and we're making it as such. 10 or fewer? Fewer than 10. Okay. So 9 or less. Fewer than 10. Correction. Fewer than 10. Okay. Thank you for clarifying that, Jill. I also want to just reinforce that proposed ordinance that we're asking our Board of Health to recommend to our council is everything that your city has the authority to do under law. We are taking this as far as we can under the extent of the law available to us. So we are taking this very seriously in Sioux Falls, South Dakota, and are taking the steps and using the tools available to us to start to further community spread. I will say that I do feel like some of our social distancing messaging has been effective and has been working. Now that we have moved up to tier 2 and 3 of the CDC mitigation strategy, this is the next step in that. The next logical step would be some sort of statewide action that would move us to another tier of mandates here in the city of Sioux Falls. We have stood up also at siouxfalls.org/COVID-19. If you scroll down to the bottom of that page, there's a box where you can ask questions. If you're a business owner, you have questions. What about me? Or how does this work? Or do I apply? You can ask questions there, and we will get you answers. But I will say this ordinance could change based on the Board of Health and City Council. This could be amended. So I would say to hold tight on those questions if you have them till 2 o'clock and 4 o'clock tomorrow. 2 o'clock is when the Board of Health meets. 4 o'clock is when our City Council meets. Then we will know what businesses have to abide by once the ink is to the paper and this is either passed or not passed. And so, to recap, we have moved to another level of response here in the city of Sioux Falls. Again, remember, this only affects the 80 square miles in the city of Sioux Falls. This doesn't affect anyone else in our MSA, doesn't affect anyone else in our counties, only the city limits. And as I've said before, the virus knows no limits. The virus doesn't know city limits. So we're doing what we can within the city of Sioux Falls. So with that, I have with me Dr. Mike Wilde again from Sanford is with us today, as well as Dr. Basil from Avera is joining me as well, VP of Clinical Quality, to answer questions on the clinical side of what we've seen. And of course, Joe Franken, as always, is here to answer questions as well. So this time I'll take any of those. Joe.
You say that you can't force closures right now under the law. So other cities have. Is there a difference of opinion among city attorney staffs from city to city then? Are you saying Rapid City's in violation of the law?
We're not going to question how they're interpreting law and how they're reading law. I'll tell you that the way that we're interpreting the law that we have to abide by, because we're having to do this at the local level, says this is the most stringent step we can take and should take in order to prevent this city from potential liability and also take a really heavy-handed approach to public health. So we feel that this is a very strong step, but a legally responsible step, and honestly, the most aggressive step that we can take in the city of Sioux Falls based on our interpret of law.
This morning, Jill said that you're hoping to learn more from the state as far as what they need to see to trigger emergency action. Have you garnered any more information from the state on that topic yet? And I guess I'll leave it at that.
So the question is, have we garnered any new data from the state that would justify a public declaration of health or anything like that from the state? We've not heard anything new from the state on that, on where they sit on that, which is why we're proceeding as planned with our plans here. And we'll continue to work with the state and take direction from the state if they get to that point.
I don't want to dominate the questions here.
Go ahead,
but I don't
Joe.
see anybody else asking. So, did you watch Governor Noem's press conference this
We did,
morning?
yes.
And I mean, how would you grade the leadership coming out of here right now? Obviously, you guys are a little bit wanting more than what you're getting right now. Can you talk a little bit about that?
Well, there's a tremendous amount of pressure in these positions. I see it on a micro level. The governor has it at a macro level. And the governor is under a tremendous amount of stress and pressure to make the right decisions. So I have probably a different level of empathy for her than a lot of people would have right now. I will say that there are armchair physicians and CDC directors all over the city right now telling us how to react and telling us how to respond. And off camera here is two incredibly smart physicians. Behind that wall is another 24 tremendous leaders in our city. The governor has access to those same folks as well, and she is making decisions based on the information that's presented to her, trying to do what's best for our state. So I have a lot of sympathy and empathy for the position. She didn't sign up for this, I didn't sign up for this, but these are also defining moments where the community's looking to us to lead, and I'm trying to lead to the best of my abilities within the city of Sioux Falls.
Can you give us the link again?
Yeah, the link, the easiest way I'll say is go to the mayor's page at siouxfalls.org, click on boards and commissions, there's a link there, and you can get to our Board of Health from there. It's probably the easiest way to get there, and you'll see the agenda as well as the copy of this ordinance. So,
Just wondering, how are you going to enforce under 10 people, like if bars or something like that, do you want people to call in?
we're still very much promoting curbside delivery, takeout, those sorts of things, because businesses can still function, can still operate in a safe manner using social distancing practices right now. That was very clear in the governor's EO, and so that's what we're trying to put into practice through this ordinance. So we're not shutting down any businesses. The government here in Sioux Falls is not doing that. We're taking very strict measures for sure, to the point where the Class 2 misdemeanor will apply in case of a violation. But we're not going to shut anyone down, and we're still encouraging business to operate within this new normal for this period of time. I believe, Stacy, this will be through 2 weeks. Is that what we're proposing? A period of week, two weeks will be the period of time. That's important too, because that allows us to reassess. Have we flattened the curve? Have we slowed this down? We don't know yet. We haven't seen a surge. 5 to 13 in Sioux Falls is not the surge. You know, this is the tip. So people say, well, is this a 2-week thing? Is this a 2-month thing? Our ordinance is for 2 weeks at a time. And I know that doesn't provide a lot of certainty to businesses to plan, but we're also trying to say, listen, we're not trying to shut you down forever. We're taking an increment. So when we say, okay, we feel based on expert advice and based on data, it's time to get the economy going again. It's time to open these back up, and we feel like we can safely do so. And so that's why we're taking it in 2 weeks chunks.
Is there any extra message that you want to send to people as we move into the substantial tier?
Well, I will say this ordinance, I feel like restaurants and bars are getting a lot of flack, and they're the target, but there's a lot of other businesses. Walmart will continue to operate. Hy-Vee will continue to operate. And there are people taking their kids got cabin fever, and they're going to Walmart with their family. You don't need to take 5 kids to Walmart, okay? You don't need to take your whole family to Hy-Vee, okay? So there are violations happening in businesses that don't fit into this mandate, and that ticks me off. But I don't know how else to say it. I've been super passionate about it by saying, people, stay home. We just took some billboards out today that we're going to be running around the city that say, you know, forget what they say, distance, what did they say? Something about distance, if we stay apart, we'll be united, something along those lines. The point of that being, stay home, stay home. You don't need family field trips to Walmart, to Lowe's, to Hy-Vee, stay home. That would be a message for me today. So I'm sick of the bars and restaurants being the scapegoats as the bad actors. You as a business owner, you as an individual, you as a patron, you have responsibility as well. There's time for some self-responsibility that people in our community need to take on this thing. And we're at that point now.
So you say you won't be forcing closures unless, could you if something changes from the state level? I mean, is there a possibility that the state could do something short of mandating closures statewide that would open up a possibility for the city to do it?
You know, the next level of this response is a public health emergency that could be declared by the state. That has not happened yet. That would allow both the state and municipalities to respond in a different way, and probably a more collective way, if that would happen. So that would be the next tier. I know the governors and her team are looking at if and when the right time to do that is.
And then if this passes tomorrow, it'll take effect at midnight tomorrow?
Question is, when this passes, if this passes, when it's effective immediately. So I don't know how we say immediately, because if it passes at 5 o'clock, is it like we start enforcing it at 6? We're going to give some grace, you know, but immediately. So we're expecting businesses to begin immediately complying.
Well, I just wonder if, since it's not technically an emergency meeting, since it was noticed, when you guys took the first action, that was an emergency meeting, an emergency ordinance. It went into effect at midnight that night.
Correct.
So I wonder if the due process type thing.
Question, come on up here. Question is a bunch of legalese, which I'm not good at, so I'm going to let my attorney speak to that.
The question, good afternoon, everyone. Stacy Koistra, City Attorney. The question is when an ordinance that would pass tomorrow would become effective. We're under a standing emergency declaration from the mayor, and so that would become effective immediately pursuant to city ordinance.
Okay.
So.
Any clinical questions while we have clinicians here on what they're seeing with these new confirmed cases of community spread for either of our physicians or for Jill?
We were asked, are the 41 case just from the state lab, or is the Avera and the Sanford labs included?
Mike Wilde with Sanford. The question was, are the 41 cases just from the state lab, or are they from Sanford, Avera combined? And this is a reportable illness, and so any positive cases, we are obligated, all healthcare providers in the state are obligated to report that. So that would, if I can say it very clearly, that's a cumulative rate of positives in the entire state.
Thank you.
When you report these cases, are you reporting, obviously you're reporting county of origin that these cases are confirmed in. Are you reporting which city these folks live in? Because the public's only learning which counties these cases are happening in, and we don't know how many of these were in Sioux Falls or Del Rapids or Hartford or Baltic. Is the state aware of what cities these folks reside in?
Per that reporting obligation, and certainly someone from the state can weigh in. I'll go back, repeat your question as well. When we report, how much information do we pass on? I'm summing you up, but how much information do we pass on to the state? We actually pass on quite a bit of information because the state then has to contact, for the sake of public health, contact that person, trace, where they've been, how they're doing, things like that.
Are you able to speak on how many patients are in the hospitals or in intensive care right now?
So the question is, can I speak on how many patients are in the hospital or intensive care right now? I can't. I can point out that we have had cases positive at Sanford, both in and outpatient, as well as persons that we rule out.
Jill, do you get information about if these cases in Minnehaha County are Sioux Falls residents or not? And if not, would it be helpful to know that?
The question is whether or not we get information about whether or not the Minnehaha or Lincoln County cases are actually in Sioux Falls. And the information that we get is really the county of residence, the gender, as well as the age range. And so it's really basically the same information that is posted on the South Dakota Department of Health's website. As far as whether it would be helpful or not, we have people that live, work, play, both in and outside of Sioux Falls, and so in the area. And so for purposes, we have all along known that we need to really regard this from a county perspective, knowing that we are responsible, though, for the city itself. But it doesn't necessarily make a difference in how we're approaching what we're going to do based on whether it's in Sioux Falls or in the county itself.
Are we getting more tests, or how's testing going?
I'm aware that there is testing ongoing, and that those tests, will be reported. Positives will be reported if they're coming from the health systems, and also testing is still tests are still being sent to the State Department of Health for processing. Samples are.
I can speak more to that.
Very good, thank you.
Dave Basil with Avera Health. And so the question is, how is testing is going? And Avera Health, we became verified by the state to begin doing internal testing on Sunday. And so we have started ramping up our testing throughout this week, and we have enough supplies for several weeks without getting any more done. And so we're really increasing the turnaround time and getting more and more tests in every day. So that's gotten a lot easier than it was last week.
How quick is that turnaround time?
It's about less than a day right now on our high priority cases. We run kind of on a tiering system on hospitalized and ICU patients because we're trying to protect our sickest patients first and also our healthcare workers. So we're prioritizing anybody that's in the hospital, anybody that's at higher risk for decompensation, and running those tests sooner. And those can be as quick as 8 hours. And then kind of our standard turnaround time is 24 hours in-house.
You said you were verified Sunday. How far sooner than that, or before Sunday, did Avera have the capability to do that? How long did you have to wait?
Right. This has been a wonderful partnership, both at the federal and state and local level, to get us up and testing. usually you think about these sorts of things, and there's a lot of red tape to get some of these things approved, and a lot of that was cut through because of all the emergency preparedness, and so it was just a matter of a few days, and I would say that's an appropriate few days to make sure that we're able to validate our results and that it's a accurate test, and so there was no bureaucratic delays. It was just a wonderful experience from that standpoint.
So can you elaborate, there's a lot of people that aren't aware, where can a person get the tests?
Yeah, so that's a great question. The question was, where can you get tested? And so we have an increased ability to test versus a week or so ago, but there's still a limited number of tests. And so there's still priorities on who we can test and who we can't according to CDC and state guidelines. And so probably the most important point to make there is we can still we cannot test asymptomatic individuals. So if you do not have fever, cough, shortness of breath, we will not be able to test you. Even if you do have some of those symptoms, if you're not either a known exposure or a high-risk group, it's likely that we will not test you as well at this point. And so we are, for Avera, you can either call your primary clinic or you can call our central call-in number, which is 1-877-AT-AVERA, and we will go through that algorithm to see whether you qualify per CDC guidelines for testing or not.
Now, if somebody is sick with something else, they still will be able to go to their primary care physician, correct?
We have been trying to convert as much as we can over to telemedicine as opposed to in-person visits in case we have individuals that are in an asymptomatic phase of this illness, and so we want to do as much of that through telemedicine as we can. So our advice is call first rather than showing up so that we can do a little bit of screening and decide, is it better for telemedicine or is it better in person, and we can kind of direct you from there.
If I could point out as well, and thank you, Dr. Vaz, that just for the community and being, as we've talked over and over again, great collaboration between ourselves, Avera, and the city. At Sanford, our testing criteria is the same as Avera's. We're sharing we have similar resources, resource needs, and so we also encourage people to call in first. We do have drive-up testing available if that's, and I discussed that this morning as well, if that's the best option, safest option for you to isolate from the community, the healthcare workers, or you may be directed to the emergency department based on symptoms. We absolutely follow the same criteria of symptoms, and we prioritize based on patient need in the hospital, based on healthcare provider, community need, et cetera.
What's the false positive or accuracy rate of these tests? Any idea?
Do you have an, okay, I'll let you, I can make it up.
So these tests they're actually looking for viral DNA. And so if the test is positive and you find, again, let me restate the question. The question was, what is the positive and negative rate, the true positive, true negative rate? Can the test be wrong, essentially? And the test looks for viral particle DNA. And so if you find that DNA, then what's called the specificity is almost 100%. If it's positive, you have COVID. If it's negative, especially early in disease, the virus maybe has not replicated enough times that we can find it. And so there is some false negative, which if you have a negative test, you still may be early on in disease. And that's been reported up to even 20-30% early in disease. Later on, as you get sicker, then that's a lot more likely to be positive.
So how do you mitigate that?
It's like any test that we do, we correlate it with the clinical picture. And so we talk about that in the hospital. If we have an alternate diagnosis, so let's say they have a tumor that's affecting their breathing, that's probably why they can't breathe. And if we have a negative COVID test, then we believe that. If we have no other explanation for that same patient to be short of breath, then maybe we still suspect COVID. And so it all depends on the clinical correlation and the clinical condition.
Can you explain the difference between the definition of disease and the definition of the virus?
Right, so like anything else, we have viruses and we have bacteria around us, in us, all of the time. And so the question is, how do you know if it's just a virus or if you actually have an illness because of that? And it goes back to symptoms. That's why we do not test asymptomatic individuals.
I would just add, and I hopefully this will get to the heart of the question, because there are terms thrown around. Coronavirus is the family of viruses. One of those is this particular virus, which is called SARS-CoV-2, and the illness it causes is COVID-19. So hopefully that clarifies it. So you'll see synonymous terms thrown around. Healthcare workers, all of us, kind of take it to mean the same thing. Yep.
All right, we're going to wrap it up. I want to finish with one thing, though, and I'd love if you would cover this and get this out, because my office is getting hundreds of calls from employees. The only way I know how to say it is tattletaling on their employer. And the mayor cannot go into your bank and tell the bank president how to run the bank. So if you have a problem with the way that you're being limited on the number of toilet paper squares you can use, to the disinfectant available to you, you need to talk to your employer. You need not talk to the mayor. I can't fix those. I'm sorry that sounds trivial. It's probably the number one complaint and concern I'm getting from people. Talk to your manager and your employer on that. So thank you for being here. We'll see you tomorrow at 10:30 for more updates.